And so I think we've got a few folks that are on from the mediation side of things. And then I know Ames will be able to join us at 7 p.m. To talk a little bit about the restorative justice work. And so I think maybe it looks like it might be best if we try to kick things off with the homelessness and addiction services. And I guess Chief and Chad, this is where I guess I'm going to ask you guys to jump in if you have anything to kick us off here, or if not, I guess we can start by looking at a couple of the documents that have been presented or offered.
Okay, I'm unmuted. Actually, I would defer to Reed more so because, and I know I'm putting him on the spot here, but I think this is more in his wheelhouse than mine.
Okay, well, I'll take it, and then I'm going to defer to Cynthia as well at some point here. So, in terms of our substance abuse programming, really what we rely heavily on is our co-responders and all health networks, so that we can get people referred into the proper lanes to get the treatment that they need to get. And so Cynthia can talk about some of the resources available there. We really struggle because we don't have a viable detox facility nearby, and our success with detox is pretty limited too. I equate them to, if we have a DUI driver and we can get them through all the processing without incident, we have them for 2 hours, they're probably a good detox candidate. Otherwise, they're not, because detox tends to not be able to deal with them so effectively, and they want to push them to the hospital or jail. So really just not a lot of good options there for detox facilities. And in terms of the homelessness, again, we go to the co-responders for a lot of resources and a lot of outreach to our people. The impact team does some homeless outreach. We have a zone officer program that's generally staffed by 2 officers. They do some outreach. They're more of an enforcement-based unit that deals with homelessness and issues related to that. And then we, as Impact, and particularly in my position, I sit on a number of groups, most notably Change the Trend, which I think we all know something about, and is really representative of about 30 organizations, some of which are at this table, that all come together to look at the issue and work on the issue and see, where we can go from there. We had some conversations last time about how do we best move forward, and Cynthia certainly addressed some of those. So if there's any questions specifically to me and what we do, I'm happy to entertain those. Otherwise, I'm going to pass it off to Cynthia and ask her to talk about her end of things from All Health.
And Cynthia, I'll say I'm sorry because I told you that you weren't up, and you really weren't in my mind. So I apologize.
Well, that's okay. I think that, when I see the agenda, I'm thinking, well, wait, isn't that the same content that we covered last week? And so I would say that, just as a reminder, substance use or overdose are classified in the same data collection category. And because they are mutually exclusive categories, I don't have a good sense of what percentage of mental health calls also involve a co-occurring substance use disorder. For substance use primary, I just went and looked at the dashboard real quickly. We average about 5 a month. So it's a very small percentage of the work that the co-responders do. And as we talked about briefly last week, we've only transported or had 1 individual transported to detox. So detox is definitely something that is a challenge. Individuals also who are heavily intoxicated are less likely to be able to be dropped off at the walk-in crisis center as well. So oftentimes those individuals are being transported to an emergency department. So it is definitely a system limitation because their closest detox provider is all the way out at the Anschutz campus. For treatment, I do think that it's important, and I would be remiss not to mention that All Health is an approved substance use provider. We have a very extensive program in a couple different locations, but in proximity to Englewood, it's our Littleton location, which is right on Sycamore Street. We have both traditional outpatient substance use services, and we do medication assisted treatment where we can do Suboxone inductions. We now do that for people at home, so they do not have to come into our office to be able to do that. And then we also have a substance use intensive outpatient program, which is for people who are coming in for 9 hours a week. So those are levels of care below residential or detox. And certainly for medical inpatient detox, folks are being trained, that's West Pines or Denver Health, but there's also a limited number of resources. All Health has the substance use program is very robust. As a substance use provider in Colorado, we are required to connect to anyone's requesting or in need of substance use services within 3 days of request. So that program, that you have to strike when the iron is hot, when someone is potentially willing to seek substance use services. And so generally speaking, we try and get them in on the same day of their request. And if not, within 3 days is our requirement. We also can do that medication assisted treatment with Suboxone induction on the same day as the initial intake appointment. So All Health is definitely a key player in the substance use space for treatment. One of the things that co-responders have an advantage of is that they're very familiar with our programs. They know how to get people in. They can get them connected for an appointment pretty immediately. We previously had walk-in intake hours. Now we're doing that all via telehealth, but it still does allow for someone to be seen again same day or certainly within the first 3 days of request. So yeah, that's the substance use landscape is dramatically changing in the state of Colorado because there is a Medicaid waiver process that was passed. It was supposed to be implemented, I believe, July 1, but the state, because of funding, had to put it on hold. So starting in January, residential substance use services will be considered a Medicaid benefit. That opens up a lot of space for new providers. So we're eager to see who is going to be providing residential treatment. I don't have a good sense of if you can do an immediate intake, say from a co-responder to a residential program, but that will be another level of care that will be available for individuals who have substance use addictions and are seeking treatment. Yeah. So any questions about the substance use service availability for Englewood residents or how we get people connected? I can switch a little bit to talk again about homelessness, but I want to give a second to see if there's any questions about the substance use continuum.
I've got a quick question. It's probably maybe more of a clarification. So you said that the categories are mutually exclusive, and that was substance abuse versus overdose?
No, sorry. Substance use and overdose are classified as one item,
Okay,
but it's separate from mental health.
gotcha. So you can't identify somebody as both, is what you're saying?
Not from the Power BI dashboard. I could
Gotcha.
probably do it because obviously we have the raw data on the back end.
Sure.
By diagnoses that the co-responders enter, but the easy, quick, let me look at the dashboard because Reed just threw this to me. No, I can't.
Sure. Gotcha. That makes sense. I get that. And then the kind of a follow-up question there is, and this is not to say that people are misreporting, but do you think that there's a possibility that substance and overdose is perhaps being represented as underreported because of that issue, that there's like a primary cause? And I mean, personally, I would generally tend to believe that a mental health issue is a primary cause and substance abuse is comorbid secondary cause, right, for the visit. So do you think that that might be skewing that surface level number a little bit?
Very much so. I don't
Okay.
think that the co-responders have only interacted with 5 people a month who
Right.
have substance use. I don't
Yeah.
think that's fair to say at all. But the challenge with just looking at that dashboard is that they are separated. Generally speaking, when we think about our crisis involvement in whatever layer we're in, we're usually at least 50% of the clients that we serve who have a co-occurring disorder. That they're
Gotcha.
dealing with both mental health and substance use. So yes, I don't think 5 is an accurate count
Gotcha.
for that.
So one last question, if it's okay. Do you feel that what we're able to provide service-wise is sufficient? Or do you think that that could use some improvement as far on any level, whether it's, I probably don't think that we have the money to run a detox as the city of Inglewood, but something, is there some level or layer of that treatment continuum where we're maybe lacking a little bit and could improve?
Yeah, I think the answer is always yes. And I would say that for pretty much any behavioral health service line. Um, I th- I know that the co-responders do have a lot of training in substance use. Some of them are dually credentialed in both, behavioral health, and they have the credential as a substance use provider. It's actually something we always look for in our organization because it's a driver in every place. The available outpatient treatment programs to serve Englewood residents, I do believe, are strong. We have capacity. We have an incredibly, our substance use program is actually our most diverse staff. We have a veteran, we have someone who's Spanish speaking, we have someone who's Asian, we have someone who is LGBTQIA. I mean, we just have a really nice representation in that program. And we also use peer recovery coaches, which is an extra layer that has had really good outcomes associated with people in substance use treatment. We have very good retention for people, which is staying in treatment. The longer that you stay in treatment for substance use, that's the number one reason why people see a reduction in substance use. So I feel like that the program we have, well, on the outpatient side is solid. I'd love to continue to grow it. The detox situation, as pretty much anyone on this call can probably attest to, is absolutely terrible, because social detox is something that there was a law that was passed in 2014 or 2013, I believe, that would no longer allow an individual who is intoxicated to be housed in a jail for intoxication or for a mental health condition. And so that's part of the impetus for getting the crisis system set up. At the time, Arapahoe House was the social detox provider in our region. And although the state passed the law that police officers jails weren't able to house people for substance use, they did not do anything to fund social detox. Social detox reimbursement is pretty bad. And Arapahoe House financially and administratively did not sustain themselves. I can't remember exactly when they closed, but it's been years, 2015, maybe 2016. And there has been no opportunity, there has been no other organization who has stepped up to the plate as a substance use provider to provide detox. It's a hot potato. There is an Arapahoe County Behavioral Health Subcommittee that I work on with the commissioners from Arapahoe County. And at one point, another community mental health center was awarded almost $1 million to be able to establish a social detox facility in Arapahoe County. Signal Behavioral Health is the organization that had those funds to be able to divvy out. And the commissioners were unable to locate a property where it could be operated. They even tried trailers. Could we instead have temporary trailers that would house people? And as some of you are probably very aware, substance use has an incredible NIMBY problem. No one wants it anywhere near their business, their location. In addition, social detox in particular by many behavioral health providers like All Health is not viewed as treatment. It's an intervention, but it's not a
Right.
behavioral health treatment. There's all different levels of detox and treatment. And so there has been a lot of, again, passing the potato of, well, who's going to do detox? Should a municipality do it? Should law enforcement do it? Should a behavioral health center do it? Who's going to pay for it? Because those programs you have to have staffing to be able, and the staffing turnover, the retention of staff in social detox is deplorable. They're very low wage, high risk, dark, unpleasant places to work. So detox is a huge problem. And I would say that, and I would turn this back to officers, but there's really no good place to take an individual who is causing a public nuisance or who is intoxicated and in need of literally detox, as opposed to a medical admission, an emergency department. There's no mental health crisis per se. And so bringing them to the walk-in center, and walk-in centers are not, they don't have infection control, like walk-in centers are carpeted, for example. Well, a detox can't be carpeted. And so things like that, they're not licensed as a detox center. So we do have a huge gap in the community in regard to detox services. And I'm probably preaching to the choir. I think most people are very familiar with this.
Cynthia, can I ask a question? Is that okay, John?
Yeah.
So what happened to the funding after the commissioner team was unable to locate a suitable location? What happened to that $1 million funding that went to Signal Behavioral Health? And how long ago was that approximately? Since there's an election coming up, I'm just thinking.
Yep. The money had to be returned to the State Office of Behavioral Health. It was an unused allocation and I don't know where the money went elsewhere. That money, the initial money that was given was $700,000, and that was in 2018. And there was no traction. And so Signal got additional dollars thinking that, well, maybe the 700 wasn't enough. And it got up to 900 in 2019, early 2019, and then still couldn't allocate it.
Wow,
So the money
thank you.
was returned.
Can I go ahead and pipe up? It's Letitia.
Yep, go ahead.
Here I am. I've been working here for 20 years back in the day, and I think Sergeant McGrath and Chief Collins can remember that we used to have a detox center in Inglewood where we would take these subjects. And it's true what Cynthia said is that nobody wants these kind of places in their city, if you will, in their community. And this one was located, of all places, by a church. Actually, I think it was part of the church. I'm not really sure. Anyways, that being said, I remember, taking people to detox there. It's a terrible place. They don't want to go there. There's fights. A lot of times officers would get called out there for calls for service simply because of what happens in that particular facility, if you will. I don't know what the answer is for having a place to put these, people who have drank too much. I mean, obviously the hospital isn't a place to go unless they're over a 3.0, I think it is. Jails aren't taking them anymore. But it's a huge problem in our community, and I don't know what the answer would be. I'm not really sure why that facility closed down, why that place closed down, or when it did. But when it did, it's, we didn't really have any place to take the drunks, if you will. And again, I'm talking in circles here, but when we did take them there, it was just a place to dump them off, and just until they detox literally, and then they're back out in the street where we got to deal with them. So it's an issue. It's a problem here.
Yep, I appreciate that you're on sort of the front lines seeing this and that there is not a good solution. One thing I would mention, the detox revolving door is also very problematic, where the same individuals will get picked up repeatedly. Special events tend to lead to high numbers of detox. The Parker Days, that was something at Douglas County, you know, whenever there's an outdoor festival or something like that. One thing that I would think it's important to clarify is that generally speaking, when we're talking about detox, we are talking about alcohol as substance use. So if an individual is in need of detox, for example, from heroin, or if they're having a benzodiazepine withdrawal, opioid, something to that effect, there are resources and they often do go through an emergency department or can be placed. And so just so we can narrow down the focus even a little bit more, we are talking about alcohol intoxication.
Thanks for clarifying that, Cynthia. That's a really, really good point. Thank you.
You know, I'll chime in also, and you know, Cynthia, I really appreciate what you said, and I just listening to you, I would also say the same thing around housing services, specifically as it relates to the homeless community. Probably most relevant for this conversation, like emergency shelter. You know, in the same way that, you know, there would be people who'd be eligible for detox or probably in need of detox. You know, I've been in situations with the impact team in particular where, you know, outreach is happening to people experiencing homelessness, usually in the lead up to a sweep along the Platte River. And the outreach is great. The impact team is there and we're in the conversation and say we're here to help connect you with any resources and say, well, do you have a place for me to go? And we don't have a shelter. So while the outreach from the police department is there, the services to connect folks with just aren't. And I'll say I'm kind of unclear on what a recommendation would be for in the scope of work of this task force. But I think it might be helpful to just name, similar to detox, homeless services are similar.
Yeah, it's a really good point. And if we can segue over to homelessness, I think that there are some opportunities here. And we did talk about that a little bit last week, and I think we could probably flush out a little bit more. I mentioned last week, and Reed and I had talked about this, the idea of contracting or all health subcontracting, depending on how things work with the RFP, or someone else subcontracting with a community-based organization that could potentially be a provider. So I had contact with Colorado Coalition for the Homeless. And so I'm waiting to hear back from a leader. Initially, I got a strong no, because they have funding specific for Denver, their service area, and the housing that they provide is specific for Denver. And some of these things, even though individuals don't have an address, residents and where folks come from has an impact in terms of the clients that they serve. There is also another organization, Metro MDHI, right? Metro Denver.
That's the Metro Denver Homeless Initiative.
Thank you. And so I've also reached out to to Matt Meyer, their leader, to try and see if there are opportunities for them to be able to help contract with some of this work. I agree with the comment that was made earlier that the outreach is there. So whether it's an officer or a co-responder, or if we were to have a case manager, if there was a case manager that was designated to ride with the zone officer to be able to do that proactive outreach, you can have those conversations. But if you still don't have a roof to put over their head, then we're still dealing with the same challenge the next day, the next week. There are voucher programs to get people into hotels. And in fact, during COVID, our organization has been involved with some initiatives. We've received some grant funding that we've distributed to partner organizations to be able to put people into hotels during COVID, in part because an individual who is homeless has many, many high risk factors that become a public health concern in terms of potential infection. So there has been a little bit of an uptick of resources for homeless individuals, but they're all temporary. They're still transient. And that still doesn't address the root of the problem. I don't think it'd be out of turn for me to mention that there is a task force that is meeting to look at a housing development in Centennial that would be for supported housing, which is a very specific type of transitional housing that allows for individuals who have a voucher to stay there for a more extended period of time and to receive case management, behavioral health, medical services to try and get people on their feet so that then they can transition into more permanent housing. There is a tract of land that South Metro Fire Department owns that is being discussed for where this building could be. There are two consultants that are involved in trying to figure out how to get this coordinated and funded through the Division of Local Affairs, DOLA. There is an architectural program through the university, I believe the University of Colorado. They're doing a charrette process to be able to get architectural students to design the building. So this is a very real reality that there is a work in progress, and it's years away. It's years away if all of these things align. There is no developer that's been identified yet, but there is an RFP process that is moving forward to try and establish more supported housing. That is very different than emergency shelters. And Mike, I don't know if you might be the right person to talk about the emergency shelter network and how that works and how that gets activated. So we're still sort of in these categories of there's the emergency, what can we do for right in this moment? Where can we take this person today? And then there's the, how do we address the underbelly of the root of the problem to be able to prevent that person from being picked up the next day? But
Yeah.
it's probably worth a review of sort of the emergency shelter network.
Yeah,
Mike, Mike, real quick, just Mike, why don't you go, and then I want to make sure that we get John, Donna, and Cheryl in after that.
yeah, I'll maybe just do like a minute on kind of the overview of what Cynthia's asking for, because I appreciate her question. So I think in terms of housing, it's helpful to think kind of on a spectrum of emergency services, emergency shelter. I would even add, we could add like safe camping or safe parking initiatives to that end of the spectrum, all the way to some of the models that Cynthia was talking about like permanent supportive housing and things like that, which would be more long-term stable situations for people who have transitioned out of homelessness. I think probably most relevant for this task force would be to think about that emergency shelter side, because if we're talking about kind of the immediate link from an officer on the street wanting to connect somebody to an immediate service, that emergency shelter piece is probably going to be the type of service that they would want to connect, because emergency shelters would be the type of model that really would kind of accept as many people as they can immediately. So those would be the types of shelters that officers would probably want to connect people with when they're interfacing with people experiencing homelessness, 10 p.m. on a winter's night. We're not completely without emergency shelter in this area. The Severe Weather Shelter Network does phenomenal work. Traditionally, they partner with local churches to provide congregate sheltering on severe weather nights during the winter months, so October through the end of April. Every year. This year, they've, to Cynthia's point, they've utilized some CARES Act funding to be able to shift their model to utilize motels. So they'll still be able to offer shelter, but they're going to be doing it in motel rooms rather than congregate sheltering in churches, just to be able to conform to COVID regulations a little bit more. And then the other sheltering organization we have is called the HAT Force, which in the past has worked in partnership with the Severe Weather Network to offer motel vouchers to folks who might not be in a position to do well in the congregate setting that Severe Weather Network offers. specifically families and then people with just significant mental health challenges. The Hat Force has also received quite a bit of CARES funding, and they're actually currently sheltering about 35 people through, and they have funding to keep that up through the end of the year, potentially stretching into early January. But to Cynthia's point, again, that's temporary. That's the sheltering services are pretty good right now because of CARES Act funding that's been present. But outside of CARES Act funding, it really is just on severe weather nights that we're able to provide emergency shelter.
And CARES Act funding has a time limit on it. The vouchers that we had applied for and have funding for all the money has to be spent by December 31st. So it's very possible there will be another renewal cycle, but it's a very temporary situation.
Thanks, John.
Thank you. I was wondering if you might know, and maybe you don't, but if those grants are something that only go to nonprofit private orgs, or if those grants are something that a municipality could apply for and potentially receive to apply to these services.
The grants that we applied for, and part of the reason why we were asked to do it, it required someone to be a 501(c)(3). And so we actually, Arapahoe County, the 18th Judicial District is who was housing the people, and they were not eligible to apply for it. It's possible
Gotcha.
there may be other grants, but the ones that we have received to date, which has equated to $120,000 in vouchers, was specific. It had to be done by a 501(c), and we're just a pass through. We don't.
Sure.
We just receive the money and then pay the hotel.
Right. Gotcha. Okay. Interesting. Thank you.
Thank you, Donna.
Hi, Cynthia. I wanted to let you know that we've actually had really good luck placing people through Colorado Coalition for the Homeless. And they've actually placed in Boulder, Arapahoe County, Denver, and we have a contact there that is fabulous to work with. So I can pass on her information to you if you'd like. But she's been a tremendous help for what we have done with homeless people.
Sure, that'd be great.
Okay.
The chief clinical officer just recently left CCA.
Okay.
And so I am working on the leadership with the outreach team.
All right.
So it sounds like you have a frontline, probably a case manager who's
Yes,
a rock star.
exactly. Exactly.
I
Yeah.
would be happy to network through them. I think
Yeah.
that what we're really talking about, and maybe if we go back to the recommendations, the recommendation may be to ensure that there is a case management component specific for people who are homeless that is built into whether it's the co-responder program or really the policing model, so that it is a resource.
Right. And
the
obviously this isn't for an emergency situation. It's to get them housing, a roof over their head.
Right.
So yeah.
The challenge that we have to, that I think the task force has to consider is that oftentimes these services are not necessarily billable. And so there may need to be, there may be a cost associated with engaging or contracting with a community partner to come and specifically serve the city of Englewood. So that is something to consider.
Thank you. And Cheryl, and then I guess I'd love to kind of come back and talk about the recommendations that we might have here. So Cheryl, go ahead.
Thank you, John. So thank you, Cynthia. One question to help myself get my head around all of this is when I go back to the first section of around the substance abuse, namely alcohol abuse, as you and Tish mentioned, and then talking about those experiencing homelessness, does Power BI allow you to have ongoing data in terms of what percentage of those with substance abuse problems have homes to go back to that are safe for them, or are experiencing homelessness at the same time. So what does that breakdown look like, if you have the numbers right now? If not,
Yeah.
that's okay.
I don't, but that is data that I could get you from the co-responder program. I think one catch to that is that my understanding is that the impact team is doing a lot of that work where a co-responder is not involved. Reed, is that correct?
Yeah, between impact and zone, they'd be doing a lot of that outreach that wouldn't necessarily generate data for the program. And we don't have a data tracking for homelessness specifically that we can gather.
Right. And kind of knowing we don't necessarily have that much for many obvious and maybe not so obvious reasons on those experiencing homelessness is why I thought maybe the substance abuse side of things might give us a little bit, a few more data points. And I asked the question because as we start to name recommendations, you know, there's massive overlap. And I just wanted to know to what degree massive overlap really exists, or how, you know, can these solutions cover, you know, be efficient, or are they separate for both challenges for the population? So just a thought there.
There was a data point from last week that 7% of all the interactions that the co-responder had was for primary homelessness. And so that's a small number, but that was one of the data points that we had. But probably for next week, or I can send it out to the group. I can try and see what I can dig into to gather a better picture of mental health, substance use, and if we have homelessness in our data set, that I can try and see about reporting that. The only concern, kind of like what John mentioned earlier, is that it's going to be grossly underreported because the co-responders are really primarily being called out for mental health emergencies, not for homelessness, trespassing, things like that. So
Sure,
but
makes sense.
I could try and get that.
Yeah, in a perfect world, right, as we look at this continuum of care and what model may or may not apply well for Englewood's population and our services, the perfect world would have all the data that shows us around the entire, you know, circle, just who needs what and who's experiencing all of these or what percentage. But we'll probably have trouble ever getting to that number. But I'm sort of thinking from that point of view in terms of that decision we'll end up making in the end.
The other thing that came to mind is that there is an annual homeless count that happens, and that is done in the city of Englewood. And so I'm wondering, you know, is that data available? Would that data be informative to the group, just to be able to understand the scope of the number of people in Englewood who are counted as being homeless? That might be helpful as well.
I can speak to that. I think you're probably referring to the point in time count, which is the annual, it's HUD mandated snapshot assessment of homelessness. That data is available. You can find it on MDHI's website, Metro Denver Homeless Initiative. The point in time data is a snapshot. It's done over 24 hours once a year. So it's a helpful snapshot of the issue, but it's not going to be necessarily a comprehensive view of the issue. For a more comprehensive view, the Tri-Cities Homelessness Policy Group is actually just finishing up a contract with the University of Denver that did a more in-depth assessment of both chronic homelessness and family homelessness in the Englewood, Littleton, and Sheridan area. And that report is being finalized right now and should be available within the next couple months.
All right, Joe and then Reed, and then I guess before everyone starts going, I'm going to suggest that we start thinking about recommendations, because it seems as though there's either a desire to get some more data, and maybe that's the recommendation, or is there also a request somewhere in here around program modification? And so I'll leave that to Joe and Reed.
Thanks. I just wanted to think, last time we talked a little bit about, you know, whether we're like preventative care and those kind of things. This seems like a relevant especially talking about addiction, a relevant place to bring that discussion up again is, do we have anything for, not just detox, but actually addiction, addiction counseling, addiction care services? So that, is that something you do, Cynthia, All Health does, or do we have a resource for that? Or is that something that could be, I guess, just thinking in terms of recommendation, is there some way, a program about actually helping people get out of addiction or preventing addiction, if that's something we could take on, rather than just treating, detox and treatment, those kind of things?
Yes, we have that full array of outpatient treatment programs for addiction, both counseling, the medication-assisted treatment, and the intensive outpatient care. So we do have that. There are other providers in the area that also do that are more dependent on payer. So it depends on what sort of insurance coverage the person has. For All Health, they don't have to have insurance coverage. So as a safety net provider, that's one of the advantages we have. So those things do exist. Prevention, there's some outreach in schools. So there are clinicians who are based in school systems, and there is a screening tool called the CRAFT that is often done with school-age children to try and identify substance use issues at an early age. And then you create CRAFT groups for families and issues like that. So if prevention was an area that you wanted to go, there are usually dollars through Signal Behavioral Health to get implementation programs in schools. The marijuana tax fund, tobacco dollars, a lot of those funds are diverted towards school prevention programs. Whether or not those prevention programs have a strong impact is another topic. But there are screening tools and family programs. There's media campaigns around substance use prevention. That's sort of a whole nother world that often lives in the public health realm. And so Tri-County Health Department is a leader in that space for prevention, and the ability to put resources to that right now through the health department is almost non-existent because everyone has been diverted towards COVID precautions.
Right. So
Did that answer your question?
Well, just one follow-up with All Health's addiction services. Is that something that we're seeing, when a co-responder deals with someone in Inglewood, are we getting them properly diverted to those services? I'm assuming that's something that's on the checklist.
Yes. And
Okay.
so I think you guys remember that, care coordination, getting connected to services is one of the keys to a successful co-responder program. 73% of the time we are getting people connected. I don't know what percentage of the time that is to a substance use program, but that's a very easy channel, assuming that the person is ready, right?
Sure.
So it is, we do have involuntary programs. I will say that there's an emergency commitment option where people can get involuntary treatment. We are a provider for involuntary court mandated treatment. Although most of the time when we're talking about a co-responder being involved, we're usually talking about someone who's voluntarily seeking treatment. So, yes.
Okay, thank you.
We've seen some good response from, I think it's coming out of Wellspring Church, for people that are going to Wyoming, particularly for alcohol abuse. Mike, can you give us a thumbs up if that's your program out of there? We've had several people that we've known that have been chronic on the street alcoholics that have gone through there and have had long-term or at least moderate-term sobriety.
Yeah, we haven't done that for a few years, but we have in the past. I can't remember the name of the organization that we helped people access, but it's been a few years since we've done that.
So certainly anything anybody can do to help in that way is helpful. And I just wanted to mention, in terms of homelessness statistics, there's another thing out there called the McKinney Bento, and it's done in the schools. And the last numbers I saw from the Inglewood schools, which are at least a year old, showed somewhere like around 330 students were living in some definition of homelessness. So that could be at the Lucky You Motel. I ran across some there last week. to, you know, relatives' couches and those kinds of things. And for those of you that don't know, the city of Inglewood has 4 different school districts in it. So when we have 330 students that are reporting some level of you know, housing insecurity, significant housing insecurity, we're only capturing a portion of the population in that number.
Cheryl, you're on mute.
Thanks for noticing I was going on. Quick follow-up to Reed, if you don't mind. That data from the schools, is that K-12 or P20?
It's K-12 because it's out of the Inglewood schools, I think would be the best I could tell you.
Ah, yeah, okay. All right, good, thank you.
So I guess I'm sitting back here listening, and I'm wondering, are there recommendations or changes that folks are thinking of to the way you're currently operating? And or is there a request for some additional data or something along those lines? And I guess I'm thinking specifically around, you know, the homeless piece, the addiction services, as well as mental health. And John, I see you've got your hand up.
Yeah, I think one of the recommendations that I think we could make is to see about either securing grant funding directly to the city or finding a partnership with a C3 org that, you know, we could assist in securing grants to potentially provide some of the either emergency or maybe longer term housing, and also some of that I hesitate to say detox facility simply because I don't know that that's really within our purview or that it would be a highly effective use, but maybe temporary or emergency housing that does not preclude people from being admitted based on their level of intoxication. So not specifically a detox. I'm kind of trying to like get around having specifically a detox, but still have it kind of usable in that way. I don't know if that makes any sense, and maybe Cynthia, you could weigh in on what I'm suggesting here.
Well, I think the realities of how detox is classified is very limiting, and
Gotcha.
it's a challenge. And being able to accept people into a housing, even if it's temporary housing, while they are heavily intoxicated, is really a challenge because the facilities are usually not prepared, and it's disruptive to other residents. There's infectious control issues that come up. I think what you're, you know, is there an opportunity to be able to do something different in Inglewood? And you know, every community is facing this challenge in, quite frankly, Arapahoe, Douglas County. It's a significant challenge. There are emergency service, what's it called? There are vans that you can contract with that'll transport someone to detox. I was on a meeting earlier today. We were talking about this, and emergency service patrol van. You guys know anything about, anyone have an ESPV for transporting to detox? And there are some initiatives that are happening in different counties to contract with an emergency service patrol van to come and pick a person up and drive them 30 miles to a detox facility. So that's not exactly what you're talking about, John, but it is another alternative of how, you know, of how do you get someone to detox when there is no detox in the region. So that would be another.
I think that's an interesting idea. I guess I was kind of trying to kill two birds with one stone here, you know, trying to figure out a way where we could provide emergency housing for a variety of reasons, you know.
Most people, though, as soon as they sober up and they're at zero, they want to leave.
Yeah.
They don't usually want to stay. So.
That makes a lot of sense.
I mean, I'm not hearing that Englewood is in a place where Englewood would like to advocate for a detox facility in the city of Englewood. You know, that would be a big lift, but that would be another option. And every surrounding municipality would use that. I mean, would there be an RFP process where there's funding for it? I mean, and again, Signal Behavioral Health is a good partner on this, but if that was something that the task force was recommending, there definitely is demand for detox.
I'm definitely
I'm-
not saying no.
Right. Yeah, I'm not either. Yeah.
I think it's something we should talk about right?
Hmm.
John and Joe.
I'm totally with you there. My initial question asking about the grants and partnering with somebody was specifically around partnering to create a detox here in Inglewood.
Yeah.
I was just trying to wedge as many things into that grant as possible.
Sure.
You
And
know.
this might be something for the Tri-Cities policy group to see if we can collaborate, whether it lands right in Inglewood or, I think that's got to be something on the table, is we got to be
Mhm.
willing to do it in Inglewood if we want to bring it before the
Right.
Tri-Cities.
Yes.
We can't start up front that we aren't even considering that option, but it would be something that if we were gonna angle for it, having 3 cities on board would make it much more possible, I think.
Yeah, we can't pitch it at Tri-Cities and be like, we totally support a detox in Sheridan, right?
Right.
Probably wouldn't
Of
go over
course.
super well.
Of course. And give me one more moment, if you don't mind, since we're talking, Donna, as a citizen, do you have a thought around this? I mean, does it seem to you something we should at least talk about and weigh in as a
Yes,
city?
there's a need for it. I think coming from, say, owner's perspective, you'll have a fight on your hands because I don't want it in my neighborhood and they don't want it in their neighborhood. And so I think you're going to have to be very specific as far as what area you're going to put it in and how accepting, whether it be businesses or homeowners or apartment people, how accepting they are of that.
So I think that was our first recommendation, John, right?
I think so. I think I'm hearing one. So let's get Amy in, and then I think we can maybe formalize at least this one recommendation.
And I hear, Cynthia, about mental health, substance use, homelessness, all co-occurring, right? And so, but I feel like the conversation tonight have shifted starting from homelessness now to detoxing. And if this city were to invest in one of those, if we had to pick one, like I want to hear from police officers, like what I think in this group, right, what they feel is most of the resources that they wish they had in more close by proximity. Because I think the magic wand is obviously all 3 and have all of those. But the goal of the task force is also like police, working with the police. So I think giving them resources, what they think is most needed, maybe also should be taken into consideration.
Anyone?
So I guess that's a question, John. Like maybe Reed or other folks, like, what do they think of the ideas flowing around?
I'll go ahead and speak up and say my part. I mean, obviously there is a need for detox, specifically alcohol. Again, not in my neighborhood, not, in our city, not my community. As a patrol officer, and I'm being honest, it's going to create more calls for service, if you will, on an already taxed patrol division. But we'll deal with it if need be. It's like sometimes I feel like, and this is just me personally, not the entire police department or their officers. It's like, no, I don't want it in my community. you know, because of that, because it's going to mean more calls for service. Oh, well, if that's the case, well, then that's the case. We'll deal with it. We've done it in the past. So that's just my feeling from a patrol aspect. So it's kind of a double-edged sword.
Yeah, I think going back to, I mean, a detox facility would be helpful. Certainly not in the way that it used to be managed. But you also need the other components. You need the treatment and you need the housing. And so therein lies the dilemma. And the dilemma would be funding. And so that's what I see. A detox facility in and of itself may become what we're trying to avoid and what we had in the past. And that was just a place to house somebody overnight without any success in rehabilitation. And so you need the other components such as like I said, I'll repeat it one more time, but the answer to a lot of things is the therapy and the sustainable housing. And I don't think we could have a detox facility without that.
And I'll just chime in really quick and say I completely agree with all this, but most of us know that we aren't going to successfully get somebody sober unless we're in a housing first model. So if they don't have secure housing, we can throw all kinds of resources at them from all kinds of directions, but we can't get them sober because they're trying to survive. For those of you that had any experience personally or just working with people, it's a daily struggle to survive.
And just from a research perspective, Housing First is one of the only known evidence-based programs to address both mental health and especially substance use. So Reed is completely correct.
All right, Mike and John, and I guess I'm going to ask us because we've got a couple guests that we want to make sure we get to tonight to see if we've got some more ideas and if we can start honing in on recommendations. And those recommendations can even just be to go off and form a task force, another task force to look at this specifically, but we have options. So Mike and then John.
Yeah, I think what I'm going to do is try to take a stab at what John tried to do and kill two birds with one stone, but potentially just putting kind of like the rapid rehousing model in front of us that is in alignment with the housing first philosophy, but maybe it isn't like a full detox center, but also isn't like is maybe one step beyond an emergency shelter to provide at least an initial stable housing situation. And just one I'm totally in brainstorming mode right now, but one idea would be to kind of like what if the city contracted with a motel to reserve X number of rooms that could function as maybe a detox, or cover a week, 2 weeks, 3 weeks, a month stay in a motel with partnerships with community organizations to provide wraparound services. And that could be an initial detox place and then provide some stable housing to maybe springboard folks into greater stability if they're in a place to take those steps. And that I think that would kind of fall within like the rapid rehousing framework and that housing first philosophy, and might be able to function as a detox scenario that might not be as congregate and might give somebody more privacy, and maybe would decrease the amount of potential conflict. Yeah, total brainstorm, but just throwing that out there.
Thanks, John.
And I'm going to take you even a step further, Mike. I'm curious as to what it would look like for us to buy one of the motels and maybe make it even longer than a few weeks. I don't know how many of you know my personal story, but I was homeless for half a decade and was a substance abuser for most of that time because, like Reed said, you're trying to medicate away the pain of your existence is really what it boils down to. I got real fortunate in that I got a very specific job with a very specific group of people, and one of them found a room for me to rent, and it took 6 months. I rented a room from a family for 6 months, and I never went back to the streets again after half a decade. And nothing that I tried before that worked. And there wasn't even like any concerted, substance counseling. It was literally just having stable housing for 6 months, and I got off the streets and stopped using and abusing drugs. So I think that the housing first model is definitely, the right path. I'm just trying to figure out how we do that and leave space for those emergency concerns, those immediate concerns, and then try to maybe coax those emergency concerns into a longer term stay. So making it, technically short-term rapid rehousing where it's, maybe maxing out at 6 months. Maybe I'm getting into the weeds here, but I think it's kind of necessary for us to like wrap our heads around what the recommendation could look like, right? So, having like maybe up to 6 months, but not requiring that people sign off that I'm going to stay here for 6 months, having it available to people in emergency situations and then saying, hey, if you'd like to stick, we've got a spot for you. And granted, we wouldn't be able to take in every single homeless person in the city, right? But we can't take in any of them right now. So, any is a step in the right direction. And if it's not if it doesn't preclude people who are in an intoxicated state when they get to the facility, somehow, I don't know if that's possible, Cynthia, to do that. And, if it's not, then it's not. But I think that's the more important piece is getting people more permanently off the street and creating the foundation for them to, re-enter society successfully.
The idea of that type of property acquisition of a motel has been floated at the Tri-Cities Policy Group, and we had a presentation. So I participate in that group, to give context. We had a presentation about 2 months ago now, I think, from a representative from DOLA at the state level, and they mentioned that DOLA does have funds that are earmarked to support that type of property acquisition. So potentially one recommendation, to bring it kind of tangible back to recommendations, we could recommend that Inglewood Police put that need in front of the Tri-Cities group to maybe just communicate that, hey, this would be something like this would be really helpful from the police department standpoint.
And Tri-Cities is also looking with a Ready to Work group called Ready to Work. They have a location in Boulder and one in Aurora, and we're having conversations with them. We met with them last week just to talk about some options and needs of the community. So that is out there. The detox thing is incredibly complicated though, and incredibly expensive.
Bridge House was also talking about something similar.
Yeah, it's actually the same organization.
Oh, is it? Okay, gotcha.
Ready to Work is kind of, I believe Ready to Work's the umbrella. Bridge House is like the program.
Gotcha.
Yeah.
Cheryl put her hand down, so let's go to Cynthia.
I was just going to add with your recommendation, just for clarification, a lot of times what I think we're talking about is a housing first model that incorporates harm reduction. And so oftentimes that's the language. And so as we dig into it, that would be something to include in the recommendation, that it includes both of those. So there's the funding stream, and then there's the provider. So who is the service provider when you're talking about a housing first model that incorporates harm reduction is an unanswered question, which is okay right now. But I think that's the language that the group is looking for.
Yeah, I see the folks whose faces I can see kind of nodding, and so are there others that feel otherwise? Let me put it that way. If so, pop your screen up or raise your hand. Because otherwise, I guess I sense that is the recommendation, to go to the Tri-Cities Council or whatever you guys call that, to then propose this kind of housing first model that really looks at harm as a primary factor. And and it is my sense right now that this is less around kind of the quote unquote policing side of it and more around just the human and the citizenry, right? And so does this request, let me ask it this way, does this request need to come from the police department? And would this initiative be driven through the police department or through some other group, the organization within the city?
So in my mind, I think that's really helpful. In my mind, since this task force is specifically crafting recommendations kind of directed to the police department, how I'm imagining it is this task force would recommend that the Inglewood Police Department put the need in front of the Tri-Cities Homelessness Policy Group for this type of service. Recommend saying from the perspective of from the police department that this type of service would be really helpful in our community, and would enhance our ability to do the type of policing that we want to do.
I think this could also come back through council as we could make the I mean, it should the police department's at the table, so certainly they could bring it up. But I think also as recommendations, our mayor could bring it back to Tri-Cities if it was a recommendation of council, and that would carry some additional weight. So I think both are valid avenues, but I would certainly include it in our recommendations to council.
Yeah, I agree with that. I think it can come from both the police department and from us.
Great, thank you. All right, anything else on that, or at least on those three? Homelessness, addiction, and mental health services?
The only piece that I think bled over from last week was that we did talk about the expansion of case management services in cooperation with the co-responder program, in collaboration with the impact team. So that recommendation might need to be moved over to this part of the conversation, but that was another piece that we had talked about.
Right, I guess my thought is that we would almost continue this list around alternate policing, and so yes, so that would be incorporated. Okay, thank you. Cheryl.
Thank you, John. I remember my question now. For perhaps Cynthia and Reed and anyone else who has the question, is there a collaboration to date with House of Hope located in Englewood that has temporary housing? I mean, their charge is domestic violence, right? Homelessness and child abuse. Many of which are...
Sorry, go ahead.
What was that, Reed?
I just called Keith Singer yesterday. I was out on the street covering a call, and Keith has actually joined us in Change the Trend. They're an active partner there, so we do have an active relationship with them.
Okay, excellent. I mean, that's like 32 beds or rooms, I think, in that facility. She
said, I will take this person and her 2 teenage daughters, and then she decided to split, but we had the co-responder involved in that as well, and
okay,
that is a good resource that we have.
Awesome. Thanks, Keith. Thanks, Reed.
Guillermo. You're on mute if you're there, Guillermo.
Of course. Is that better?
Yes.
So I was just listening to the conversations around homelessness and the detox centers and mental health, and just the process. It seems like a really long process that, to really land on something tangible. In the meantime, I feel that there are a lot of barriers. Cynthia, you alluded to them, that the citizens don't want them in their neighborhoods. And finance, who's going to pay for this, and all of these things. I also feel while we're in the process of moving this along, what's the narrative that we start to tell? Because if the Tri-Cities says, great, yes, let's move Inglewood, let's just say we have space for it. the last thing we want, and I think Mike mentioned it, is the citizens all of a sudden up in arms over it. So just as we think through this, let's begin to craft a narrative and what's the story of the benefits to the police department, the benefits to the community, so that we have support once things are ready to, once we're ready to pull the trigger on something. I don't think we want to tell that story after the fact. We need to tell this narrative during the entire process.
So I think I hear you making a recommendation that the recommendation also includes some language around, I guess, the selling points, right, or the benefits.
Yeah, we have to sell this in.
Okay. So would that work if we included that as an additional recommendation supporting that initial one?
I mean, I would use the term community buy-in to see the benefits of this in terms of, this is part of also the qualitative data from the police departments, right? They say that if the community wants us to do our work differently, they have to invest in these things, right? And so we're saying as a community, we want to invest in these resources that are focused on harm reduction. And through that can also be part of our reform, right? And our efforts for policing. And then I think that's a narrative that I, as a citizen, would understand, right? Just a thought around how to phrase that.
All right, thank you. Okay, anything else on these? So I want to yield the floor. We have a couple of folks from the city that you guys are probably more familiar with than I am. But Madeline, I know you're on the line and represent the mediation program. And so I know you shared a couple of documents this morning, but I'm curious if you can give the group maybe a quick overview of what's going on in the program and then be available to answer any questions that the task force might have around the program specifically.
Can you hear me now? Awesome. Okay, awesome. Thank you for having me. I also have Steve Charbonneau on the call. He is the mediator that we have contracted with. So I'm just going to give a quick overview of the program within the city, and then he can talk more about mediation. So about a month or two ago, I had a call from a neighbor, and she was having some issues with her other neighbor. She asked if we had any mediation services. So I started just exploring mediation. I got in contact with Steve, who has mediated with other cities, and we started the program. We got together with the police, with the code enforcement team and the community development team. And we have an internal process that either a department can offer or recommend that 2 people or more people go to mediation, or a resident can also sign up for mediation. It is free to the public, and it is just something that we started about a month ago, and we've had a few referrals, and we're just looking to get it off the ground. Steve, is there anything that you want to add?
I can answer questions. I can talk about any part of that you'd like me to. Recently, component about that would be most useful for the group.
All right. I guess since this is a fairly new or very new program, I guess first, are there any questions from the group about the program? And then I guess my second, well, let's wait for the first question, then we'll deal with the second one. Nate.
Can you give an example of what a successful mediation looks like?
So we're a nonprofit organization, and we do a number, specifically really a number of different types of mediation. We focus on neighbor-to-neighbor community type mediations, and we also focus on employment, and we also focus on civilian police. And so the success of either of those looks a little different. We do probably over 250, 300 neighbor to neighbor in a given year. Oftentimes, we live in a society where people go to work, they come home, they drive into the garage, they shut the garage, and they don't talk to each other. When something goes wrong, it can be a fence line, it can be a barking dog, it can be kids having a party, it can be any number of things. I could give you a list that goes on forever. They don't know how to talk to each other. And because the first time they've often spoken with each other is in the context of conflict, it's really helpful if they have a third party, a mediator who knows how to bring the skill set together. We arrange for that mediation. We get the parties together, we talk about it, we enable them to choose what solutions work best for everybody involved. We write up an agreement, they sign it, and we follow up in 30 and 60 days to make certain that it's working and that it's successful. That is typically how a neighbor to neighbor one runs. The civilian police type mediations are generally when you've got a civilian who files a complaint against an officer for things like they don't feel that the officer was professional, they don't feel like they were communicated with adequately, they feel in some instances like they were either handled roughly or not carefully enough when it comes to an arrest. And you don't really have an opportunity to talk to a police officer in those kind of conditions. It's kind of, you do what you're supposed to do and that's it. We found that it's really helpful for a community. It's really helpful for civilians to be able to sit down in a neutral environment with a professional mediator and have both parties. The officer's oftentimes frustrated because they don't have a chance to explain their perspective. The civilian is frustrated because they don't have a chance to explain theirs. Both parties get to sit down and talk about it. There is not a written agreement that comes out of those. It's typically a facilitated conversation. And currently we're about third in the country in the number of those that we do. And we're running at about an 85%, 82 to 85% satisfaction rate from the civilian, about a 93 to 95% satisfaction rate from the officer on those.
Thank you.
Thank you. Any other questions?
I don't have a question, but I have a comment if that's okay. I'm really, really excited, again, from a patrol officer's perspective standpoint, if you will, about this. I think it's awesome. I think it's about time. We do respond, unfortunately, to a lot of neighbor disputes, which are generally not criminal in nature. And, you know, it is a call for service, so out we go. And I hate to, I hope I'm not being negative or anything, but it's not the best use of resources as far as a patrol officer, you know. It's something non-criminal, and like Steve was saying, it could be anything like an argument over a fence line. I literally got sent to a call years ago about a neighbor complaining about the next door neighbor's water coming over to their side of the lawn, and you know, what have you. So I think it's great to have this available, and that way, you know, we can go off and take other calls for service, or most importantly, be a little more proactive as a patrol officer out in the street. So I think that's great. Thank you.
I think, Letitia, to respond to that, I can't tell you how many water issues we actually do end up mediating. And currently we contract with Thornton, Aurora, Denver, Colorado Springs, and we'll get a substantial number of referrals from police officers, because you do get called out for calls to service. You have to respond to things that, while they're a really big deal between two neighbors who are fighting, are probably not the best use of your resources or your time. And we help those folks actually write up an agreement. And that's not something you're probably going to be able to do when it comes to, you know, responding to those kind of calls. They're certainly not, they very seldom rise to the level of a citation. And so having that kind of a resource, I think you'll find that really helpful. We work closely with all of the different police departments. I think you're on mute.
You're on mute.
If it's a call for service, it's a call for service. We're going to respond.
Mhm.
Because sometimes it doesn't happen very often, but these things escalate to criminal, charges, fights, somebody lights somebody else's bush on fire and stuff. And I think that's something that we need to, try to avoid, if you will. But as far as being, the first call, the first person that's going to respond to these kind of neighbor disputes should not be a police officer, if at all possible. So.
Yeah. And if you do respond, we're going to give you, you're going to have a card that you can give them and say, hey, I think you guys need to sit down and talk to each other. I'm going to pass this on to the mediation folks. They're going to give you a call in the next 24 hours, and they're going to try to set this up. We mediate days, evenings, weekends, whatever works best for the folks that we're working with. And yeah, you're going to respond the first time to the call to the service. This is going to prevent you from responding the next 5 times.
Yeah. And then one last thing, and I'll be quiet. Again, it's great because we don't have the luxury, if you will, to give these kind of calls, the time that they truly deserve. So, thank you.
All right. I have a question, but I'm going to wait for John and Donna to probably ask it before I do.
Thank you. I'm curious. So you said within 24 hours is how is the turnaround time?
From the time we get the referral, we're going to respond. We're going to call the parties. We're going to make contact with them within 24 hours.
Gotcha. There's something that Letitia said that really stuck out to me, which was it is a very time-consuming thing for our police officers to be going to, quite frankly, non-criminal for the most part, right? Would that be fair, Letitia? Say that for the most part, they generally tend to turn into you kind of de-escalating a situation, these two people going back into their homes, and then maybe in a week they call you again.
Yes, absolutely.
Right. So I like that the mediation eliminates the second, third, fourth, fifth call. I'm just wondering what we can do to stop wasting our patrol officers' time on the first call, or if that's even possible. And maybe it's not. I fully accept that it may not be, but is there maybe a lower tier of response agent, that we could employ to take these calls that, when somebody says they won't get the stupid dog out of my, okay, well, I don't want to send the patrol officer to that, right? But if you're the only people we have to send, then we don't have any other options. So I guess
I don't think we do.
Yeah. So I'm wondering if there's room for that as a recommendation to have like a non-officer response for non-criminal calls.
So let me go ahead, and I see you thinking about that, Letitia. Let me go ahead and offer an idea. If somebody's going to call 911 and they're going to ask for police to respond, you pretty much your police officers have to respond.
Absolutely.
On the other hand, the more effective that Inglewood can be in getting this up on their website, getting this information out to their citizens, giving examples of the kind of things that we do mediate, the more probable it is for people to say, well, I'm going to call those guys first. And so we see an increasing number of people who will go to that website and will either contact Madeline, fill out the form, whatever steps Inglewood has put in place, they'll at least look for some of those resources. Now that isn't going to take away the person who just gets furious, angry, and the only thing they can think of is, I'm going to call 911 and I'm going to get even with my neighbor. But having some of those other pieces in place at least gives some other resources and gives some other options.
Yeah, absolutely. And I just want to make clear that if they do call 911 or our general dispatch or what have you, we're going to respond. It's okay. It's a call for service. I hope that people aren't getting the idea that, we're not going to simply respond to this. We're just going to punt this call and do something else. That's not the case. I'm just really happy that there's another step, if you will, after the police officer gets there for a call that's non-criminal, that's not criminal nature. You know, we will still respond to that call and other calls that are non-criminal nature. What I'm happy about is that we have a resource or another avenue to refer
Second step.
problems to.
Yeah.
And I don't think we've ever had them before. We're really good at, you know, doing that, you know, de-escalating and such, but then the problem occurs, doesn't happen very often, but it has, where they just keep calling and they just cannot get along for whatever reason, so.
All right, thank you, Cheryl.
Thank you, John. So Steve, I have a question for you. Based on what I know, which is limited, regarding your program, and knowing Englewood the way I do, knowing the Neighborhood Resources Program that Madeline Hinkfuss directs, I feel that the approach of that context of having that resolution is very friendly, neighborhoodly. It seems like a really positive way to approach the resolution of this. At the same time, I'm wondering, one, in the other cities in which you've worked and seen successes through this type of mediation, is the contact point typically through something like a neighborhood resources program, or is it typically a 311 number, something like 911, that maybe is more closely affiliated with the police department, or both? Like, is that the right place to house that contact point is basically what I'm asking. It feels like it to me, but I don't know.
Sure,
Thanks.
sure. So it varies depending on the contracts that we have in the different cities. I would say our largest contract is with Denver, and probably I would think that the most effective intake process is in that way, where those referrals can come to us from a number of different directions. We will regularly get city council who will refer constituents over who are just fighting. We will get referrals from the police. We'll get referrals from neighborhood services, from animal control, I mean, there's a whole list from different departments. It's understandable that that's funneled through Madeline's office. That makes sense. There needs to be some kind of gatekeeper on that. But I would hope that your other departments, your city council, your police would certainly know that this is something that they should take advantage of and can send those referrals over. I would not want to limit it to only the contacts that, you know, neighborhood services has.
Thank you. Thank you, John.
All right. Looking around. I don't see anything else, and I guess I don't know if I'm not really hearing any recommendations here. I think this is more almost just like an informative bit because the program's just kicked off, and that perhaps down the line there might be some recommendations from this task force, at least, or at least from this perspective. Is that fair for me? I want to make sure I'm not missing anything from everyone on the phone here. All right.
And I think, John, if I can interrupt for just a second, I mean, we'll certainly be monitoring the program as we move it forward. Not everyone says yes to mediation. It's a voluntary process. I can't make people sit down and communicate with each other. So we've got some people who are going to say no. The percentage is not huge, but we'll be monitoring those statistics. We do a survey, an online survey for everybody that goes through the mediation process. So we gauge their session rate. I'll be working with Madeline as we continue to try to implement this more and more. So there'll be plenty of information out there about what we do.
Great. Well, thank you. And thanks for your input.
Thank you for having us.
Thanks. And I think all of you saw the brochures. One of those brochures has my phone number on it. One has our intake coordinator, Sarah's, our general number. If you have any questions, please do not hesitate to reach out to me. And I think you saw our email, cmc@Find Solutions. Don't hesitate to reach out to me on that.
Great. Thank you.
Thanks.
All right, so I think we'll keep on moving, and I see Ames is on the line once again. And so Ames, thank you for joining us once again this week. We had kind of hoped to get to Ames last week in terms of talking about restorative justice, but now we have time this week. So Ames, would you like to hop on and give us just an overview of the program, and then we can see if folks have any questions for you?
Yeah, absolutely. Thanks, John. Can you all hear me okay? Hopefully. Okay, wonderful. Hello, I'm Ames Simpson. I'm the restorative justice consultant for the city of Inglewood. So I was hired in May to work with different entities in the city, the police department, the municipal court, the school district, the neighborhood services, as well as community members to define how and what can restorative justice practices look like in Inglewood based on the needs of our community. And so what we've done is we have an advisory committee of folks from all of those entities, including city prosecutor and city attorney and deputy court administrator, deputy director, deputy chief of police, as well as commander with the Inglewood PD, the school services coordinator from Inglewood Schools, Madeline, the neighborhood resources coordinator, as well as a community member. And we're looking for more community members to participate in what does it mean to utilize restorative justice to set up a program here in Inglewood. And so we've been looking at 3 specific areas of organizational planning and development, community engagement, and training to really be able to talk through what the program could look like. And so from that, we've looked at data from the courts as well as Inglewood PD to identify how we might want to go ahead and recommend a program would start. So the recommendation is that we would start programming as of 2021, and we would work with youth offenders anywhere from age 10 to 17 who had committed some kind of criminal legal offense, either status, petty, or misdemeanor violation. And if they hit all of the requirements, which I will name what those are, that they would have the opportunity potentially to go through a restorative justice program. So the requirements that we've talked about and recommended as the committee is that if, number one, a huge element of restorative practices is it has to be victim-centered. So if there's a primary victim involved in the offense, the victim has to be willing and give approval for it to go through a restorative justice process. The person has to be taking some level of responsibility in order to be eligible to go through. And their age would make a difference. They'd have to be within that age category as well as the offense that they committed. That would need to be within that category that we've recommended as I just described. And it's also similarly to what they were talking about as far as mediation, it's a voluntary process. So if someone chooses to not go through the process, then their case would automatically go through the legal process as it would regularly. So we are looking at offering, and again, recommending, because we're not doing programming as of now, but we would be looking at offering 2 restorative practices. One is called a restore program model, which is a specific model to respond to shoplifting. And because that's a prevalent offense here in our community. And the other model would be the community group conference model, which would be holding circle or conferences, as you might hear these terms in restorative practices, for other criminal offenses outside of shoplifting. Again, within those stipulations of the age of youth and offense. So we're also talking about how would we engage the community as far as getting volunteers. We would definitely be relying on volunteers to become trained as community members to participate in the conferences themselves, but also in becoming facilitators or circle keepers. So there's quite an investment and a plan that we've been talking through of what could that look like as far as what training is needed, what are the standards here in Colorado from the Restorative Justice Council in Colorado. For those of you that don't know, Colorado is one of the leading states in the country in how we utilize restorative justice practices. And we are the leading state in the country as far as having RJ built into our laws. specifically with youth. So we have a lot of support at the legislative level and at the state level to set up this program and some guidelines and standards for what that could look like. So there's been a lot of momentum, a lot of getting out there and sharing with different community entities what we're up to, what we're hoping to do. At this point, you know, we're waiting to see what funding comes through, you know, from City Council and what that will look like. And from there, that will determine at what level we're able to kind of launch programming as of next year. But that's kind of where we're at. I guess one other thing I would say is maybe y'all are wondering, like, what's the difference between mediation and restorative justice? So restorative justice, without going into too much of a philosophical area here, it's really about asking the questions of when a crime occurs. So it's a legal criminal offense that we're looking at, not just civil. When a crime occurs, we're really asking the questions of who was harmed, how are they harmed, who needs to be responsible for repairing the harm, and what does repair look like? So it's not just that a law was broken, it's that relationships are broken, it's that communities are broken, it's that trust is broken. And so the approach is bringing people together in a facilitated conversation, both offender, victim, but also community members that then are able to speak to the impact of these offenses on the larger community. And it's not to shame or blame the person, but it's to hold them responsible. And from that process, a contract is agreed to by everyone in the conversation of these are the items that the responsible party is going to complete within a certain amount of time. So they're still held responsible, but they're also, the victim has a voice in the process, the community has a voice in the process. It's a repair all around versus just this punishment model that tends to exist in the legal system. So I will stop there. That was a lot of information to share with you.
Thank you. Any questions? Thoughts around this program? Wow, Ames, I guess you did so well. No one has any questions.
A lot to digest, so I get it.
I spoke too soon. Cynthia and then Amy.
Ames, thanks so much. I appreciate hearing about restorative justice. And if you dig deep enough, you'll find that I wrote a systematic review about restorative justice and social work practice a number of years ago. I'm a big believer. I guess my question is how the restorative justice program connects to police, because my understanding and a lot of the work that's done is that it's more related to courts and legal charges and the judicial system. And so what I didn't catch is you were explaining, you did a really nice job explaining your role and what's happening as the program is developing. I was less clear on how that would connect with law enforcement. And then obviously I'm wondering, you know, how the co-responders might potentially be involved in that. Can you speak to that a little bit?
Absolutely. Thank you for your question. So we're talking about different referral opportunities for people to be referred into the program. What I will say is that we're still having discussion because obviously we want to make sure that we're on firm legal ground as far as where the referrals are coming from. But what we've been talking about as a committee is that there are opportunities for police officers on the ground to potentially be able to refer, or at least say, I'm giving you, well, two thoughts, either be able to directly refer to a restorative justice program, or to say, here is your ticket. However, I'm recommending that you go through restorative justice and we will be back in touch with you. So we're really trying to talk through what would the process be so that there's minimal additional, there's really no additional impact for police officers on the ground. We don't want to try to create new or different systems or more for them to do, but really creating a back end system that it would basically be seamless, as if this person meets all the requirements to participate, they could potentially be referred through the police department or directly from the city prosecutor. So those are the two areas that we're looking at specifically. And again, it would just be kind of working the back end of what that process looks like and making sure that we're on firm legal ground. I will say that there are organizations in the state that do have police officers directly refer, and that's worked for them, but there's also some question around the risks that creates. And so again, we're wanting to just be mindful of what that can mean for Inglewood here. I would also say that there are certainly opportunities for community members to directly refer a case. That would not be criminal most likely, but it would potentially be more in the civil range, or just some conflicts that emerge potentially as well, which again, not that we want to go into the territory of the mediation program whatsoever, but there are some different elements around restorative mediation or restorative practice that are a little different from mediation. So I would say those are the three elements that we're looking at, but you are correct that most programs in the state of Colorado, at least that I'm familiar with, are through municipal courts or through the DA's office.
Thanks for clarifying. I appreciate it.
Yeah, you bet. Thank you.
Amy.
I actually have a separate question, but I wanted to follow up real quick, Ames. When you said there was a increased risk around direct referral, what did you mean by that? Or maybe I misunderstood.
Just to name that so the program that has been going on a long time here in Colorado, for 25 years. The way that they get referrals into their community restorative justice program is directly from police officers. So police officers are able to directly refer, rather than give a summons to the offender. If they meet all these criteria, they will directly refer them to the restorative justice program. So potentially even pre-ticket, this person would go through the restorative justice program. As we've been digging deeper on this, and Alex, please feel free to jump in if you want to add. I see you're on this call. Just as we've been digging deeper, we just want to make sure that legally that officers, is that within their jurisdiction of decision making, or legally do we need to set up a system that actually would, we would say, well, the officers can recommend that, but ultimately the city prosecutor has to sign off on that process.
Yeah, that sounds all sorts of questions about like who gets referred. So separate conversation. But my question is for Inglewood. How many, maybe I missed it in one of the emails, the number of folks who go through the restorative practice model in the city of Inglewood, maybe this past year, or maybe pre-COVID, right?
Yes. Yeah, so thank you for your question. So if I just can add, the reason why we're coming up with very strict standards and requirements of who can go through the process is because we want to cut down on the gray of, as much, cutting down on the bias as much as possible around who can be referred to the program. So that's why we're trying to be really clear on these are the 4 things that need to happen or be in place in order for somebody to be referred. But what I'll say is, as well as, so we haven't actually started programming yet. We are just in the development stage, but we're looking at starting programming as of next year. So I don't have any data at this point around that.
My bad, I missed that. I remember that now. Thank you.
Yeah. Thank you.
So,
Cheryl, go ahead.
So we have 15 minutes left, and I don't know how many recommendations we have are we doing okay? I feel like I'm getting a little lost with restorative justice. Like I don't understand how that ties into what we were doing with regard to police reform and looking at the wraparound services that could potentially be improved to build an improved continuum of care model. But maybe I'm just missing something huge here. So I feel like I just got off track with where we are. Maybe it's me.
Cheryl, I guess, and I'll say this as somebody that just has the high level view, and the request came from city council, right, to do this work. What I see is that these last couple of ones are really new programs that are being initiated or just being kicked off, and that there really isn't enough to go on in terms of making recommendations or changes. And so I think this is more like just for your edification, just like, hey, here's the program, here's what's going on. I imagine if you had heard something that was significant that warranted a recommendation or a suggestion for change, we would kind of raise that here. But otherwise, I think that these couple of programs that are new are just meant to be, hey, here's what's going on, and an awareness kind of thing.
Okay, great.
I agree with you. There is a good amount of overlap. And then a lot of this right now, we're starting to touch on programs that are not necessarily within the police department's purview.
Okay.
I just had one comment that the thing about restorative justice, and Ames can correct me if I'm wrong, but I think it has a place with this group. You know, it is a new program. It's just for your edification, but it's providing a larger voice in the community for the criminal justice system. The community is taking more of an active part in how justice is meted out, if you will. And so I think it does have a nexus, and but of course it's in its infancy, so we'll see how it turns out down the road. But that program probably will get implemented after January.
Paul, go ahead.
Sorry. Ames, I have a quick question, and then obviously I think, but do you have any data from other jurisdictions that have successfully implemented a solid restorative justice program and how it does impact police services, and whether or not it has an impact on calls for service or the types of calls or recidivism and things like that?
Yeah, thanks for your question, Paul. So I don't have that data right at my fingertips to say, here's the direct correlation to calls for service specifically. But what I will say is that if you look at programs and there's research, actually RJ Colorado is a great website. It's kind of all things restorative justice here in Colorado. And if you were to, research is on there for various programs, and the recidivism rate, if someone goes through a restorative justice program across the state, is about 8 to 10%. So 8 to 10% reoffense rate. The way that we look at success within restorative justice is that they complete their contract that they agree to, and 90 to 95% of people that go through a restorative justice process complete their contract. Number two, it's what was the satisfaction of the people that were involved in the process. And again, that's anywhere from 95 to 99% of people that go through a process, victim, offender, police officer that are a part of those conversations, community members, facilitators, they're saying that they are content with the way that the process went. They feel like justice was served and that repair was done. And then thirdly, looking at recidivism, contract completion, and satisfaction. So those are the three that the way that we look at restorative justice success, at least historically, how those have been measured. But I will say that as far as the link in my view, and John, I would agree with you in that the restorative justice practices really also bring in this human element to police officers because they are asked to participate in the restorative justice process. So it actually humanizes the officer to be able to say in the conference, here's how this call impacted me. Here's the different options that I had. Here are the things that could have happened, or these are the calls for service I'm being taken away from. So there's a community building element even in the process that happens itself. And you know, I've also heard from different programs, you know, through stories, but that the police officers feel like it's a really beneficial tool to have to be able to share with the community, still holding people accountable, but doing it in a way where the community is involved in their own repair of what's going on in the community. So again, I would just recommend the rjcolorado.org is a great website to go to for more information about that specifically.
And just one quick follow-up on that. Is there a place for restorative justice, say post a critical incident involving police officers, or would that be outside the purview of what you look at?
As far as like a response with with police officers specifically, or with community? Is that what you're asking? Or
Post officer involved shooting. So if there was an officer involved,
Right.
shooting, would there be a place for restorative justice after something like that?
there could be, absolutely. And that's outside of the scope of what we as a committee have been talking about. But if you look at the implementation of restorative justice on more of a philosophical, larger level, absolutely it could be a part of that response within this trauma-informed lens of what's gone on. So restorative practices can be utilized both in the reactive sense of crime or conflict, but also in the how to support one another, build community connections, build social capital, those kinds of pieces. So we can expand the way that we're utilizing these. We just haven't gotten to those conversations yet here in Inglewood so far.
Yep.
Thanks.
Thank you.
All right, anything else here for Ames or restorative justice? All right, well, thank you. Thanks for that, Ames.
Thank you.
So I guess I'm gonna do a little sanity check for us right now, because realistically, this was, I think it is the last one that we have on our calendars officially. And we're trying to set up another meeting for next week, and I'm working with some folks in the city to get that done. And so that should be the plan, and I'll send that out as soon as we get the meeting invite. But I guess I need to pause because there's two areas that we need to go back to. One, which is the hiring and training discussion from week one. And so I guess Chief and Chad, I probably need an update from you both as to the timing for those materials, because if not, we'll have to push the session out, I think, because that's the bulk of it. And then the other piece that I think that we still have to kind of wrap up is just this cahoots and STAR discussion. And I don't really know how much further we need to go in that based on kind of the conversation we had last week and this week. I appreciate some input from anyone that has insight on what we need to discuss about those two programs. But probably most importantly is how do we get the materials that you folks requested for the hiring and training discussion so we can do that. So, Chief, do you have any insight, or Chad? Oh, Chad, you're on, I see.
Yeah, I sent that infographic out just to kind of give some context as to what we were talking about a few weeks ago. I don't know if everybody had a chance to look at that, but it's very basic, but at least it gives an idea of how we view training, how we mandate training, how the state mandates training. And I just kind of wanted to have that available to everybody on the call so we could move forward with that discussion relative to what was already discussed previously.
So let me make sure I understand, Chad. So the one pager that you sent out, is that the sum of what we should expect around the training and hiring discussion?
Training, yes. I'm a little confused on what we still need to wrap up in terms of hiring, but as far as training goes, when we discussed that a few weeks ago, and I was explaining the 3 points in which we view training, one being from the state. I just wanted to include that infographic in there so people could at least look at it and have an idea of how we look at training and how we implement training.
Yeah, and I don't think there was any further questions on the hiring. I think the group made recommendations, if I'm not mistaken, that evening in regards to, the +2 hiring and whatnot. So I think that part of it was covered. So, but if not, then somebody raise their hand and we can answer those when we need to do that.
I'm opening up the meeting minutes right now. So let me take a quick look at that.
And Joe has his hand up, so.
I'm sorry, I'm flipping screens.
Moderate,
So go ahead.
Really do both of those at the same time.
Thanks, Cynthia. I was just going to jump in on the discussion regarding the alternative policing. I thought we kind of pulled all that together last week with Cynthia's presentation that included reference to Cahoots and STAR, and the recommendations we came out of that kind of covered that. Was I missing, had we not covered everything regarding that? I felt like we'd kind of wrapped that up.
So STAR, just if I can answer that, the STAR program is the same as Cahoots, so they're not different. The STAR model follows the Cahoots program. That was something that I covered last week and is in some of the materials from last week as well. So, and I think there was pretty strong agreement of the group that we didn't necessarily, that there wasn't a recommendation to go with the STAR program, in part because it was heavily focused on homelessness, because well, there were a few different reasons why we talked about that maybe the STAR program wasn't in the recommendation list from last week. And others, if others have thoughts about that, but that was what I did feel like that I had covered that last week, and that was what the group had talked about.
Thank you. I think you're right, but I make sure that everyone else is in agreement.
I did not, and Joe, maybe I'm misrepresenting what you said, so stop me if I do. I didn't take away from last week the fact that we had thoroughly discussed STAR as an offshoot of Cahoots, as Cynthia explained to us, and both possibilities, and made decisions on what recommendations pertaining to Cahoots or the STAR version of Cahoots to Englewood. I didn't feel that that was wrapped up and done in terms of recommendations. Is that what you were suggesting, Joe? That we had gone through that thoroughly?
Yeah, well, that's what, sorry, that was the outcome of the Cynthia's presentation, I thought were our recommendations regarding alternative policing. And those recommendations were to continue with a co-responder program and add a couple of pieces to that, because the co-responder program covers quite a broader range. While it includes the homelessness stuff, it covers quite a broader range of needs as well. So that's what I thought. My understanding of the conclusion of that conversation was that those recommendations were inclusive of a consideration of Cahoots and STAR.
John and Mike.
So obviously I wasn't there for the conclusion of that conversation, but I just want to reiterate what I had said before I had to hop off the call last week, which was that I do not see STAR and Cahoots as specifically a homelessness addressing program. I see it as an alternate response program to limit the number of non-criminal calls that we have police officers responding to. And I tried to make it really clear that I didn't want the conversation to just be about homelessness services, because it is not a specifically homelessness services program. It is an alternate response program that handles any and all non-criminal calls, which comprise 40% of the responses that our police department, or 40% of the service calls that our police department responds to. 40% are non-criminal in nature. And so having an alternate response that does not require law enforcement to be the only response program, the only response resource that we have, was the entire reason that I had brought Cahoots to the table and STAR to the table and asked for us to consider this. So if the reason that we're saying we're recommending against STAR is because we have adequate homelessness outreach, that is completely missing the whole point of talking about alternate response.
I do agree with John in terms of what City Council decided, what we were discussing, and why we went down this road of it's not to just deal with homelessness or treat that piece. I literally thought we would end up with a recommendation that took into consideration all of the facets of needs that the community our police and team serves, and sees how we can better apply the services that exist, maybe new services, to some continuum of care model. and homelessness is one of those.
Yeah, and my recollection of the recommendations from last week was that like the co-responder program is not specifically focused on homelessness, and the expansions that
is.
recommendations. What was that?
Oh, sorry.
Yeah, the co-responder program is focused on primarily mental health response, which intersects with homelessness, but is not only focused on addressing homelessness. And I do remember, I thought it was particularly helpful, kind of the different categories, the more proactive outreach, the 911 diversion, and then the co-response, and we would fall under the co-response category. And I do remember some of our recommendations were looking at maybe expanding into some of those additional categories. I remember STAR in particular being one of the topics in Cynthia's presentation. I don't remember extended conversation around a recommendation around it. So I could go either way. I feel really good about the recommendations from last week, and I could go either way as to whether we want to have a more focused discussion around STAR or the Cahoots model.
And just to clarify, I wasn't meaning that that there wasn't an element of criminal, other non-criminal stuff besides homelessness. I was just recalling the slide that Cynthia, and maybe I don't want to put anybody on the spot, but Cynthia could probably correct me, is that it seemed like there was a slide that said how many calls STAR responds to and what specific things they were dealing with in those calls. And the vast majority of them, I thought, I say this with a little hesitation, not having numbers in front of me, or a good majority of them were dealing directly with homelessness stuff. Whereas we were comparing and contrasting that with our co-responder program, and our co-responder program actually responds to more calls, this is how I'm remembering it, than the STAR program. And ours are, while they are some of them dealing with homelessness issues, it's actually quite a bit broader than that. That's why I came out of that meeting, and I'm happy to discuss this again at the next meeting, but I came out of that meeting feeling like, okay, we have something special going on, we should build on it, and it's working, it's dealing with yes, there's a police officer along, but it's a mental health services along on those calls as well. So we're getting kind of both options there at the same time. And I felt like it was meeting, our co-responder program was meeting the intention and perhaps more than a STAR program would. But that being said, it's 8:03 and I don't want to drag this out any longer. So maybe it is worth putting on the agenda for another meeting.
Yeah, my sense is now after this discussion that we probably need to defer this conversation around STAR, Cahoots, and our existing program from last week and just kind of close that up. And then I think the other piece is just to come back to the whole training and hiring discussion and make sure that this committee has the data that they need to make recommendations around that one. That was 4 weeks ago that we looked at that. So I'll work with Sean and some other folks in the city to make sure that we get this on the calendar and get the Zoom and all the right registrations set up. And then I'll send that email out as soon as I can. And the only reason I'm going to delay, and I'm going to say this because Sean will hear it, is if you can't tell, I broke my wrist and my elbow this past weekend. So I'm going to the doctor tomorrow and I might be in for some surgery, but we'll see what happens. And if not, we'll make sure somehow that the invite gets out. But if you can put a soft hold on next Wednesday, and then we'll follow up after that.
I noticed your sling, and I was going to ask what you did to yourself. What did you do? Were you skiing? What were you doing there?
I was riding my bike, and it wasn't even as good of a bike ride as I wish it was for the accident that I had.
Oh, I'm sorry. I hope you recover quick.
Me too. All right. Well, thanks everybody for sticking around a couple extra minutes tonight, and we'll follow up and get this thing. And I think we can wrap this up next week and then have our recommendations for the council all ready to go. Thanks for your patience and your participation. We'll see you soon.
Have a great night.
Thank you, John. Thank you, everybody.